Step to the Future 1 كانت البداية وكان أول مؤتمر للجمعية المصرية لزراعة الأسنان واتعمل في اسكندرية سنة 2018. كان مؤتمر جميل جدا، ونجاح المؤتمر ده خلانا نفكر إننا نعمل تاني مؤتمر 2019 Step to the Future 2 اللي كان برضو نجح منقطع النظير. وكملنا بعد كده بستيب تو ذا فيوتشر 3 اللي اتعمل سنة 2020، وكان الحمد لله نسخة أنجح من النسختين اللي قبله كمان، وحضور كان كبير جدا. لكن بسبب الكورونا اضطرينا إن احنا نتوقف لفترة، ورجعنا لكم تاني بستيب تو ذا فيوتشر 4 سنة 2024. لكن النسخة دي كانت أونلاين، وكانت في شهر رمضان الكريم، وكان معانا سبيكرز كتير جدا. نجحت قوي النسخة، ودخلنا في 2025 ستيب تو ذا فيوتشر 5 وبعدد أكبر من الدكاترة وعدد أكبر من السبيكرز وعدد كمان كبير من السبونسرز والشركات اللي بتجيب لنا هدايا. وأخيرا السنة دي ستيب تو ذا فيوتشر 6 سنة 2026 في رمضان ده، منتظرينكم تتفرجوا على المحاضرات. كورس الزراعة بتاع الجمعية المصرية لزراعة الأسنان بدأ من سنة 2006، يعني بقاله دلوقتي 20 سنة، يعني يعتبر أقدم كورس يمكن قائم لغاية النهاردة في مصر. الكورس ده فيه محاضرات وفيه نظري وفيه ورك شوبس وعملي يخلوك قادر ان انت تشتغل معظم حالات الزراعة اللي بتيجي في العيادة عندك. بتدرس من اول introduction وكل حاجة والتريتمنت بلاننج والسيرجيكال بروتوكول وبيشنت سيلكشن والسوفت تيشو مانجمنت هارت تيشو اوجمنتيشن والبروسيسز والكومبليكيشنز والفيليرز، وكمان بتشتغل بايدك على بيشنت. يعني انت بتتدرب على كل حاجة بلس مجموعة من الورك شوبس. مش هتطلع من الكورس ده الا وانت ان شاء الله عارف تشتغل كويس. آلاف الدكاترة اخدوا الكورس ده معانا، وان شاء الله ربنا يقدرنا وآلاف تانيين هياخدوا الكورس. يلا تعالى جوين الآلاف اللي هياخدوا الكورس معانا.
مساء الخير وكل سنة وانتم طيبين، رمضان كريم. أهلا وسهلا بكم في النسخة السادسة من مؤتمر Step to the Future اللي بتقدمه الجمعية المصرية لزراعة الأسنان. معاكم دكتور محمد سلوك. في البداية بنحب نشكر سبونسر محاضرة النهاردة، شركة برو دنتال وكيل زراعات زيروس، على دعمهم الدايم للمحتوى العلمي. وكمان حابين نفكركم إن معانا جوائز. كل اللي عليك تعمله إن أنت تعمل شير لللايف وتعمل تاج ل5 من زمايلك، وكل ما تعمل تاج أكتر كل ما فرصتك تزيد في الفوز. في نهاية المحاضرة هيتم إعلان الفايزين. يشرفنا النهاردة وجود دكتور أنجيلو كارداريلي، واحد من أهم وأبرز الأطباء في مجال طب الأسنان، واللي أكيد هنستفيد من خبرته ومحاضرته القيمة. We are honored today to have Dr. Angelo Cardarelli with us, one of the most prominent doctors in dental history. Dr. Angelo, you can start.
Good afternoon, everyone, and thanks for the introduction. First of all, Ramadan Kareem to all of you. It's a great pleasure and honor for me to be here in this online Ramadan conference. And today I will introduce this new concept in order to treat atrophic jaws. Talking about the customized implant, the new solution that nowadays we have in our hands to treat the atrophic patient. As you know, if we have atrophic patient, we can have different solution according to the age of the patient, according to the health of the patient, according to the clinical situation. I mean, according to the quality and the quantity of the bone, according to the quality and the quantity of the soft tissue. So we have different options that we can use in our daily practice. And I will show one of them that actually we can use in our practice for treating atrophic patient, no bone patient, using the residual bone of the patient. Why? Because as you can see here, in the upcoming years, we will have a huge number of edentulous patients in one or in both arches. So if we will have a huge number of those kind of patients, we need to have the solution. And as I told before, we have many solutions, bone regeneration, so bone augmentation, sinus lift, vertical augmentation, all-on-X procedure using tilted implant, zygomatic procedure, and now I can introduce this new approach in order to minimize the invasivity for the patient, keeping the same outcomes in terms of the aesthetic, in terms of the function for our patient, reducing the invasivity. So if you have a case like this, upper jaw, huge resorption. And as you know, the resorption, it's different in terms of the speed and the direction in the upper and in the lower. Why? Because we have different kind of bone quality. So basically in the upper jaw, according to the muscle forces and according to the quality of the bone, we have centripetal resorption. So the maxilla goes back. In the lower jaw, according to the quality of the bone, we have more cortical bone. We have the opposite direction in terms of the bone resorption. I mean centrifugal resorption. So the mandible goes forward. Why is it important to know that? From the prosthetic point of view, because when we need to rehabilitate this patient, not only from the surgical point of view, we need to manage properly the prosthetic part, considering this condition. So as I told before, one of the options in order to treat the atrophic maxilla could be the zygomatic implants, one of the solutions. So using long implants in the zygomatic arch, but be careful, because also for the zygomatic implant, we need to manage properly the surgery, and especially if we have some problem, some issue, we need to manage. So why I can say that customized implant and subperiosteal implant is better compared to the zygomatic implant? Because it will be easier to treat any kind of complication. But anyway, one of these technique is the zygomatic implant, okay? But be careful, because if you don't know how we can do properly this surgery, we can have a big mistake, big issue in terms of defection, in terms of the not correct implant placement, as you can see from this X-ray. So be careful when we are talking about the zygomatic implant. So I would like to introduce this new concept. So actually we have the possibility to produce from the titanium dust, using the 3D laser sintering process, this titanium framework, customized titanium framework according to the anatomy of the patient. And it's very easy, the production, starting from the CBCT plus the digital impression. Then we can produce this customized implant from the titanium dust using the 3D lasering sintering process. And have a look at this amazing image. This is on the cadaver head, because at the end of the lecture, I will show that if you want to start to use this surgical procedure, you need to learn the protocol, because it's a surgical and prosthetic protocol, but you need to know how we can manage the open flap procedure. But the key in this procedure is the soft tissue management. So you need to know exactly the procedure that we need to use in order to place those titanium framework. But the most important thing is we need to know how we can cover properly those titanium framework in order to reduce the risk of the titanium exposure, deviations, okay? This is the key in this kind of surgery. That's why we are doing several cadaver training courses on this procedure, because first we need to learn about that. Then we can start with the first case. So as I told before, from the CBCT, we can we can plan virtually this project, as you can see in this case that we did on the cadaver head during our courses. And as you can see, in this case, we have two customized implants for the full mouth rehabilitation on the right and on the left side. We have several screws that we need to put in order to stabilize this customized implant, because another important thing is the reduction of the mobility. We don't need to have mobility of this titanium framework, because mobility means bone resorption. That's why in order to stabilize, in order to fix properly those customized implants, we need to put the screw. And in this systematic that I'm developing with AB Dental, all of them are 1.2 diameter, different lengths according to the residual bone of the patient. And as I told before, the key in this procedure is the screw placement, mini screw placement. Why? In order to fix and in order to stabilize properly those titanium framework. Okay? And I'd like to share this new publication in order to see the difference between zygomatic implant and customized implant in the treatment of atrophic jaws. So if you see the difference, we can say that we have more soft tissue stability in subperiosteal implant. We have less micro movement compared to zygomatic implant. And basically, if we have any complication, it will be easier to manage in our dental office compared to the zygomatic implant. Also, with the zygomatic implant, we can have the soft tissue exposure. Okay? In terms of the duration, if you need to make a full arch rehabilitation, of course, we need to spend more time for the subperiosteal. Why? Because we have more screw that we need to put. But if you compare the complication, in 35% of the patient treated with the zygomatic implant, we have infection in the sinus, sinusitis. So be careful. And the stability of the tissue, it's much better in the customized implant. But we need to know how we can cover those customized implants with the soft tissue. Also, the mobility, it's less in the customized implant. You know that in the zygomatic implant, we have a very long implant, more risk of the micro movement. Micro movement means inflammation, not osseointegration. So at the end of this review, what we can say, that customized implant is a predictable procedure, is a guided procedure starting from the CBCT. And if we have some complication, it's easier to manage in our dental office. But anyway, our goal should be keeping the same result in terms of the aesthetic and in terms of the function for our patient. Don't forget this. The important thing, that's why we are doing this training on the cadaver head, and the next one, it will be in Italy, in my city, on the customized implant from 2 to 4 of June. I will share the advertisement. The important thing is to know the anatomy, to know the dissection of the anatomical structure in order to protect and in order to avoid any issue. For example, we need to know that in the upper jaw is mandatory to use this buccal fat that we have in the thickness of the cheek. This is bolla del Bichat, is the buccal tissue, the fat that we have in the thickness of the cheek, and is mandatory to use in order to cover properly this titanium framework, in order to reduce the risk of the exposure, in order to improve the protection around on the top of the customized implant. If we don't know the anatomy, if we don't know the procedure in order to reach and in order to identify those anatomical structures, we will have a lot of problem in terms of the digestion. But again, we can treat compared with the zygomatic implant, finally with the customized implant, we can treat upper and lower. Can you imagine if you have a case like this? Again, his cadaver head dissection during our training course. If we have bone resorption, old patient, we can avoid this issue placing customized implant, avoiding the mental nerve, exactly like this, as you can see in this very nice picture that we did on the cadaver head during our training course in Italy. And again, this is a mandibular case, lower jaw. You see here from the CBCT, we can plan 2 customized implants, not one piece. Why? Because if you will place only one piece, you will have more forces. Our goal is to reduce the forces, and that's why we need to split, okay, in order to avoid the risk of the tension on the screw, okay? And from the CBCT, you see 2 customized implants in order to treat the lower jaw. But as I told before, there is a protocol that we need to follow, because the customized implant needs to be very, very precise in the procedure, starting from the diagnosis, starting from the planning, starting from the CBCT, starting from the intraoral impression. Is very important from the prosthetic point of view. And this is the new kind of customized implant with titanium surface treated. Finally, we can have the multi-unit abutment, so we have a screwed restoration. The superiosteal implant, the PSI or customized implant, is the same, different kind of name, but it's the same, is an upgrade, because it's an old concept with something new, okay? Also, many years ago, we had this kind of customized implant, superiosteal implant, completely different. Poor quality in terms of the surface, no screw with the restoration, no screw for the fixation, so mobility, exposure, infection. Those are the main difference comparing the old concept of customized implant and the new trends in the superiosteal implant. Don't forget this thing. This is the present, but this is also the future. Screwed restoration, titanium surface, very, very precise, only one surgery. And this is the protocol. First of all, we need to identify the patient. Which are the indications? Patient in which we don't have any other option. So it's the last option for the patient. We can do bone regeneration for health problem, for the age of the patient. So as last option, we have the customized implant. Okay, this is the last option. But again, we need to follow the protocol, starting from the CBCT and from the digital impression. This is titanium 5. This is the properties of this new implant surface. In the past, we had a very poor quality in terms of the surface. Now we are titanium grade 5. High quality is much better for the integration in terms of the bone and in terms of the tissue. Let's see the issue that we had in the past with the old concept of customized implant. Exposure, infection, mobility, bone resorption. Why? No screw, only press fit. The press fit can cause bone resorption, so be careful. Now it's completely different because, as I told before, we can use the digital workflow. CBCT, intraoral scanner, we can get this kind of new customized implant with titanium grade 5 in terms of the surface. This is the present, this is the future. customized implant in order to treat atrophic patient, as I did in this patient, in which I put the 7 screw in order to stabilize this kind of customized implant. But I will show later on the procedure. So in terms of the surface, is completely different, because we have the screw and we have this titanium grade 5. So which are the advantage? The possibility to treat patient without bone in only one surgery. We don't need to wait time, because also we can do immediate loading. New surface, possibility to treat also old patient in only one surgery, following always the contraindication. But of course, we need to know the anatomy. We need to know how we can open the flap. We need to know how we can manage the soft tissue. Needs more skills in terms of the soft tissue management. Okay, of course. This thing is very important. Also, the production is completely different. In the past, it was necessary 2 surgeries. One surgery for opening the flap, for taking the impression, then closing, then the second surgery to put the customized implant. Now it's completely different. We have the digital workflow. So from the CBCT, and using the 3D laser sintering process starting from the titanium dust, we can get and we can produce a very precise titanium framework. Have a look at this 3D printing model that we can produce starting from the CBCT. Is related to the previous case that I showed a few seconds before. You see the anatomy, you see the precision of this anatomy related to the CBCT. And this is the plastic titanium framework that we can use during the surgery to check in the fitting and also to explain, to show the patient the concept of this new procedure. But if you will see here, it's very precise. So from the CBCT, we can produce the titanium framework and we can receive this 3D printing model. Okay? And of course, we have the plan. And for example, in this case, we are planning to put this titanium framework with the 7 screw according to the residual bone that we have. And this is the shape. This is the shape of those titanium framework according to the plan. Healing cap, 3 multi-unit abutment, and the 7 screw. And in order to produce this titanium framework, we can use this 3D laser sintering machine. As I told before, for the first time, we can produce from the titanium dust this customized titanium framework, which is the advantage, the possibility to produce a very precise titanium framework using the 3D laser sintering process. Using this machine, then we can produce this titanium framework with multi-unit abutment for the screwed restoration. But let's see how we can use clinically in our daily practice this procedure. I want to show this case. 75 years old patient, upper jaw, right side, no bone at all. We have only the sinus. Let's see the intraoral view. We have the tissue, we have this situation. Of course, we need to prepare the CBCT. So from the company, first we can receive this plan according to this CBCT. When we will see the plan, of course, we need to approve. So we need to make also some changes according to our experience, according to our clinical experience. So for example, in this case, I prefer to change something because I want to increase the length of this titanium framework where the bone is better in terms of the quality in order to increase the stability. So I want to put 1 screw more on the zygomatic arch, because on the zygomatic arch, the quality of the bone is D1. So if you see this project compared to the first one, it will be different because I changed something, okay? Like this. After that, we can approve and we can receive within 3 weeks the 3D printing model with the plastic guide. So we have 7 mini screw 1.2 millimeter with 3 multi-unit abutment. For the screw head restoration, have a look at the precision on the palatal side. Here you can feel and you can see the high precision of this procedure. 3D printing model, plastic guide, to reproduce the anatomy of this patient. And when you will start the surgery, you will receive this package from the company. And in this package, you can find all the tools that you need in order to manage the surgery. The planning with the screw, the CBCT, different lengths of the screw, as I told before, the planning, the certificate, and the package with the customized titanium framework, the drill for the screw, or the tools for the prosthetic part. So scan body, digital analog, everything. We are ready for the surgery. And here in this box, you can find the customized the plastic model with the plastic guide that we will use for the surgery. Everything is inside. You see here the model. Okay? It's so precise. You can feel it. You can see here the fitting is perfect. It's amazing. Okay? Like this. Okay? So let's start with the surgery. This surgery has been done in the conscious sedation with the intravascular injection in order to manage properly the patient. So have a look at the 3D printing model. The important thing is to see the surgical procedure. So let's start with the surgery. Which kind of flap? Full thickness flap with 2 vertical incisions, 1 mesial and 1 distal, because we need to open more. As I told before, we need to have a good surgical view. So 2 vertical incisions, 1 mesial, 1 distal. And also we need to open on the palatal side because we need to put also 2 screws on the palatal side. Be careful. The flap should be bigger. Why? Because we need to avoid that the incision should be will be on the titanium framework. So we need to be far away from the customized implant in order to reduce the risk of the soft tissue deviations. Okay, it's very important to follow this procedure. So slowly, we can open the flap, okay? We can open the flap. It will be full thickness flap, of course, as you know. You know that always we have a fibrotic tissue between the bone and the flap, so we can use this plastic guide to check if the open flap is enough or not. It's not enough, so we need to open more because I need to put 1 screw on the zygomatic arch. That's why, sorry, I'm using this plastic guide. Now it's much better because we can see finally the zygomatic area. And also you can see through the tissue some fat. This is the bisha. This is the fat that we can use at the end of the surgery. Now I'm doing some periostal incision to release more the flap. Okay? Then when we will be ready, we need to open the package and we can put the customized implant. And now I will show the fat that we have in the thickness of the cheek, and I will show how we can use at the end of the surgery. Okay? More incision on the periosteum. Okay. And now you will see then when I will put the customized implant, it will be already stable, means high precision. Just to put the screw, just to fix the screw. And there is no a sequence, just to start from the screw that it will be more easy for us to place on the bone. So just to start from the most comfortable area in order to put the screw. There is not a specific sequence. So now we can open the package and we can put on the bone the customized implant that it will be already stable, as you can see here. Okay? This is the shape of this PSI. Look, already stable. No, now what we can do? Just to put the screw. There is no specific sequence. So starting from this screw, all of them are 1.2, different lengths according to the residual bone. And we can put the screw manually or with the maniple. Usually we are using the maniple on the palatal side and on the lingual side because it's difficult to use the straight manual driver. So it's better to use the maniple. So now just to continue the screw placement, nothing difficult in this case, just to stabilize with the first screw, then we can go ahead. And here I'm using the manual driver also because I want to feel the torque, I want to feel the stability of the screw during the placement, okay? So just to continue the screw placement, okay? And we have also two screws on the palatal side. The last screw, it will be on the zygomatic arch. It will be the longer one, 13 millimeter, to manage and to fix the customized implant in order to improve the stability of this titanium framework. It's very important to put this long screw for the stability of this titanium framework in this case, okay? So now we can continue. You can see that there is a small gap, but when we will put the screw, we will have a close contact between the customized implant and the bone. We have only one drill. Now manually, I'm putting the screw so I can feel, as I told before, I can feel the stability and I can feel the torque after the screw placement. Perfect fitting, no gap, means high precision. This thing is very important when we are talking about the customized implant and the subperiosteal implant. Don't forget this thing, okay? Now we can continue in the posterior side, and also we have two screws on the palatal side. Here, of course, you will find more cortical bone, so the bone, it will be harder compared to the buccal area. You see here, I'm using the quadrangle, the maniple, because it's easier to put the screw. The last screw, it will be on the zygomatic arch, the longer one, 30 millimeter. And when I put the final screw, you will feel also the quality of the bone. The bone, it will be so hard, okay? 13 millimeter, 1-3. You see the screw, and that's it. Okay? Now what I'm doing, I'm finding the fat that we can use to cover the titanium framework, okay? This is the fat. So slowly we can release and we can stabilize on the top of this titanium framework using the resorbable suture. It's very important We don't need to cut, but just to identify, just to release and to move on the top of this titanium framework. We don't need cut because we need to keep the blood supply. The important thing is to improve the protection and to hold, creating a double layer, one layer with the fat and the other layer with the flap, to manage properly the covering of this titanium framework. So one layer with the fat that we can fix and that we can hold using an absorbable suture, then we can cover the flap. Why? To increase the stability of the soft tissue. Then we can finish with the interrupted sutures and the vertical mattress around the healing cap, exactly like this. Now we have two options: immediate restoration, or we can wait, not osteointegration, but I prefer to wait the healing of the soft tissue. So you have two options. You can do immediate restoration, or you can wait few months, not for the osteointegration of this titanium framework, but in order to have better healing in terms of the soft tissue, because as I told before, the quality of the soft tissue is mandatory for the success of this procedure. So after a few months, we are ready for taking the impression for the temporary, 6 months later, and also for the final restoration. Have a look at this CBCT 6 months later, showing the stability, the very, very precise fitting of this titanium framework on the top of the bone is very important. And this is the final case, the final OPG, good compromise of this case treated with customized implant with the screw and the restoration. The important things after the surgery is to wait the healing, to take antibiotics therapy, to maintain a good oral hygiene, and of course, to use also the painkiller and to reduce to smoke or the use of tobacco in order to have better healing in terms of the soft tissue. And we did this publication also about the treatment of atrophic jaws using the customized implant. So what we can say, that customized implant, if using properly according to the protocol, is a predictable therapy. And of course, we can use also in the mandible. Have a look at this case. The patient came for a previous failure of the vertical augmentation in the short implant. So when I saw the patient, I planned it as last option. She already did bone augmentation, failed. Short implant, failed. The last option, customized implant. So from the CBCT, we can create this 3D planning like this. So we have 5 screw and 2 multi-unit abutment for the screwed restoration. Exactly the same. The same concept in the upper, the same concept in the lower. The difference is the management of the lingual tissue in the lower jaw. The same thing, 3D printed model, plastic guide, nothing different. And I want to show the surgical procedure, the same thing. In the package, you can find everything. So I will skip this procedure, the planning, the alveolar nerve, and the 3D printed model. And let's see now the surgery. Okay, so I'm using the plastic guide to be sure that my flap, it will be enough for this procedure. So we can start a little bit lingually. Here the problem is the management of the lingual tissue because we don't have the fat. So how we can cover properly this titanium framework, managing the lingual flap. Same flap, 2 vertical incisions, 1 mesial and 1 distal, full thickness flap, trapezoidal flap. Be careful that in this area we have the emergence of mental nerve. So full thickness flap, slowly, in order to identify and in order to reach the mental nerve, because the mental nerve is going very superficial in this case. This is the mental nerve. Now we need to open lingually, and lingually also we need to increase the length. So now, basically, I'm doing as I did in the previous case, the periostal incision, because I want to increase the length of the tissue, because the key is the covering of this titanium framework from the soft tissue, with the soft tissue, sorry. And how we can manage this? Lingually, using brushing movement to increase the length of the lingual flap. Is mandatory in this procedure to move the lingual flap like this, because as you know, the lingual flap is fixed. The important thing is to move the lingual flap, increasing the length. Now we can put the plastic guide and we can check if everything is okay. Now with the piezo tips, I'm removing not the bone, I'm removing the residual tissue related to the previous failed surgery. Now we can try again the customized plastic guide to be sure that everything is going well. More periostal incision to increase the length. Be careful because there we have the mental nerve. Slowly, slowly around the mental nerve, okay? Now it's moving, but we need to be sure that also the lingual flap is moving like this. Otherwise, it's impossible to cover properly the customized implant. We can have early exposure. This is one of the problems that we can have using customized implant. Now it's much, much better. So we are ready to put the titanium framework, just to open the package as we did in the previous case, nothing different. Okay. This is exactly the same. Okay. Already stable. What do we need to do? Just to put a screw. It's very easy. Starting from the most comfortable area in order to put the first screw. The first screw is very important to stabilize and to fix properly the customized implant. Okay? Just to continue, we can use the maniple or we can use the manual driver. It depends from the view, okay? Just to finish the screw placement, it's very easy, nothing different compared to the previous case, okay? This is the last screw. Also, in this case, I didn't make the immediate restoration. Why? Because I prefer to wait the healing of the soft tissue, because it's the key. The soft tissue in the SPI procedure, in the customized implant, is the key. Now we can close. Interrupted suture on the mesial and the vertical mattress around the healing cap, like this. Okay? This is the post-op OPG. Before and after. Then, this is the resume of this procedure. Have a look at the healing a few months later, around the multi-unit abutment. So we can take the impression for the temporary. Those are the temporary with the PMMA, 4 months later. This is the clinical view with the temporary again, screwed temporary restoration. This is the CBCT, 4 months later, showing the perfect fitting again, and the perfect inclination of the screw according to the plan and according to the alveolar nerve. No discrepancy, perfect fitting. Okay? You see the healing after the temporal restoration. It's very, very nice. You see here. And we can finish the case with the screwed restoration. Much, much better also in terms of the tissue. Okay? So, what we can say at the end of this procedure, that we can use as last chance for our patient. If we don't have any kind of alternative according to the age of the patient, according to the invasivity, we can use the customized implant. If you want to approach of this procedure, you need to learn the protocol, because it's not only related to buying the customized implant and to put like this. No, you need to learn the protocol. That's why, if you want, we will have the third international course from 2 to 4 of June in Italy, in my city. It will be cadaver lab session. Each doctor will have the head, the CBCT, and he will put the customized implant. He will see how we can manage the soft tissue. And the day after, we will have the live surgery on patients. So it's the first course on customized implant on the cadaver head, using the CBCT, using the real planning, and plus the live surgery. So if you want to have more information, if you want to start with the customized implant, please join us during the next training section on the cadaver head here in Italy using customized implant. So thanks for your kind attention, and please, you can follow me on Instagram, and if you have any question, please feel free. So thanks again for your kind attention, and have a good evening. Thank you. Shukran to everyone.
Thank you so much, Dr. Angelo, for this valuable lecture.
Thank you. Thank you very much.
كورس الزراعة بتاع الجمعية المصرية لزراعة الأسنان بدأ من سنة 2006، يعني بقاله